Hello, and welcome to this session of the Advancing School Mental Health Conference, Compassionate School Mental Health Practices to Foster Resiliency and Recovery. Today, we're here with Dr. Chris Mason, who's the Executive Director for the Center for Educational Improvement, Dr. Martha Staley, who works for the Program for Recovery and Community Health at Yale University School of Medicine, myself, Dana Asby, I'm the Education Coordinator for the New England Mental Health Technology Transfer Center, and Stacy Champy, who is the MTSS District Coach for Manchester Schools in New Hampshire. We do want to let you know that most of us are staff members at the New England MHTTC, and our funding comes from the Substance Abuse and Mental Health Services Administration. During this presentation, all of the viewpoints and opinions expressed are those of the presenters and do not reflect SAMHSA's official position. At the MHTTC network, we use affirming, respectful, recovery-oriented language. That means that our language is always person-centered and strengths-based, and we hope that as you share some of the ideas that we present today, that you'll consider this language as well. Now I'd like to pass it over to Dr. Christine Mason.
Thank you, Dana. You can go to the next slide. So our work in New England and the 6 New England states has centered the last few years around a childhood trauma learning collaborative initiative. We've had at any point in time between 20 and 26 fellows who've joined with us. These fellows are psychologists, social workers, school administrators, and other educators who are really representing their individual states and working in a very collaborative way to share resources. Next slide. The mission of this Childhood Trauma Learning Collaborative is to enhance school culture and prepare school personnel to improve the mental health of school-age children in New England. And as you think about it, you know, look back historically in schools, there has not been much of a focus on mental health. Yet we know today the needs are huge. Think about COVID and everything we've experienced the last 2 years. There is a tremendous needs for more mental health supports, and there's much that can be done in schools. Next. So during the first year of the project, we first brought on board about 20 or 24 fellows, and we worked with them to establish community building so that they could support each other, share information and knowledge, and consider what their needs were at the individual level. We took their intelligence, their information of local needs as we built up our network. During year 2, the focus was on school culture. We have an assessment instrument that I'll mention in a minute that we use to assess what's going on, whether or not there was compassion, understanding, and support for the children who are most at risk. We had many, many webinars, some on things like neuroscience, what happens to the brain when in fact there's trauma. We had sessions on working with parents, for example, and on what schools and teachers can do to support each other and to support kids. Dana, please tell us about year 3.
Absolutely. During year 3, which was the 2020-2021 school year, we know that all of the schools that we work with and other schools throughout the nation really experienced a lot of hardship during the COVID-19 pandemic. So we really pivoted our planned work to deliver things that the fellows let us know they really needed. One of those things was mentorship. We had a group of senior fellows who worked with us during years 1 and 2, and we brought on some junior fellows who the senior fellows mentored throughout that year, telling them about the knowledge that they had gained in the first 2 years. We also formed some affinity groups based off of the topics that fellows were most interested in learning from each other about. Those included a group about leadership in crisis, school culture assessment, and also about compassionate practices in schools. We continued with our monthly webinar series, delivering topical webinars on things that the fellows let us know they needed more information about. We also conducted some wellness events, including our Compassionate Conversations in Schools project, where we brought fellows and Heart Collective members together to learn wellness tips and have conversations about their successes and challenges around those wellness topics. Martha is going to talk later about the Heart Collective and the work that we did with them in year 3.
Next slide. One of the bases for what we did focuses on work that we really began at the Center for Educational Improvement back as early as 2009, 2010. And what we've done is we've come up with a model where we believe if we want to see compassionate action, which we believe is really central to mental health and well-being, we need to start with a platform of mindfulness or consciousness, being aware of our own emotions, what's happening to us internally, and also being aware of others. From that awareness, then, we have a basis for more compassion. However, compassion does not come easily to everyone. If, in fact, you've been abused, you've been in a situation where you've experienced significant trauma, you may find it difficult to be compassionate to others. You may not really even understand the concept because no one has really expressed compassion to you, or you may feel threatened or intimidated because you may sense that you're giving away your power. So building compassion can be a major project and needs things like role-playing, modeling, so teachers and administrators would demonstrate compassion in even things like their discipline practices. However, with practice in classrooms, with a focus on compassion and weaving compassion throughout the curriculum, we find that students and others teachers, staff, gain confidence in their own sense of well-being, their self-esteem, and their success in school. With that confidence, then they can have courage. And courage is something we don't talk about much in education. It's really underrated. However, when we look at courage, think about what's needed. If you're being bullied, if in fact you see someone else being bullied, if you see a situation where there's injustice, tremendous courage is needed to speak up and to help others. So we work on those 4 C's in the context of a community. We call this a heart-centered community. We're building community because we know these relationships are so central to what happens. All these things together lead to more compassionate action. And really our premise is that with this compassionate action, then we can help to alleviate the stress and trauma that oftentimes will lead to a more serious mental health concern. Next slide. So there are many things that we have written about, we've spoken about over the last 2 or 3 years that really expound on what we're going to be talking about today. Here are 2 of the resources. The book Compassionate School Practices is something that Dana, Martha, and others along with me wrote at the beginning of this year. It was published in January of 2021. And in this book, we talk about everything we're discussing here today. I want to begin, though, with a thought from Ireland. So I want you to realize that what we're talking about today isn't just for the US, it's really an international movement. And this is from 2015 from the Irish government and their Department of Education. Mental health should permeate all aspects of school life and learning. Effective schools should therefore put systems in place to promote mental health and well-being, and thus build resilience in both staff and students to help prepare them to cope with a range of life events. Next slide. From this premise of heart-centered learning, we thought about what schools might do to be better informed and more engaged and more proactive in the supports they provide to students who most need this support. We came up with the Compassionate School Mental Health Model. And you notice at the center, we're putting youth, home, community, schools, and systems. So that's kind of the center or the heart of the work. And around the periphery, we have 4 quadrants. We believe that these are the 4 essential aspects that you need to follow. And whether you do tiers of support or screening, or whether you have, all the mental health supports you really would love to have in your school, these 4 things can be very helpful under any circumstances. Start with prevention. What can we do to reduce the cause of serious mental health concerns? One of the things we know is literacy. So educate people, educate the educators, and also students, families, so that people know about mental health concerns, and promote what we call holistic wellness, not only physical wellness, but also think about self-esteem and how you get along with peers and what you can do to alleviate stress. That's really important. The next quadrant, supporting youth. For youth who have the most serious needs, they need to know that they have support. That support can be so crucial. So what can we do? Is it wraparound services, mental health counselors, working with others in our community? There are so many ways we can better support youth. And believe it or not, sometimes we think our job as educators is to educate and to focus on academics, but these types of supports and actions will make it easier to teach and easier for students to learn. So we also want to build resiliency. That's that sense that I can bounce back, that I really can handle the stresses that come to me. We can do this in some very systematic ways in the schools by working with youth to give them that sense that, yes, they can do things, that sense of confidence, of agencies, working on social emotional learning. And then the protective factors. You've probably all heard, one nurturing adult can make a huge difference in the life of a child who has faced an adverse experience. So teachers and others in the building, it could be counselors, it could be custodians, could be that protective factor. So we want to make sure there's a sense of community and protective factors. Next slide. So we'll pause for a moment. You can go ahead and set your computer on pause and just look at your community and fill out this form. What are you doing? What are the strengths and weaknesses? One of the tools we have to help support what's going on is Escade. This is a tool that we developed, validating it on over 800 educators throughout the United States. It's an easy to use assessment device that can be completed in 12 to 15 minutes. Teachers and other educators in the building complete it with a self-rating scale, a scale of 1 to 4, where in fact 4 is exemplary and 1 is, we really need to get started. We're kind of really at the beginning. So this goes along with the heart-centered approach, and it measures aspects of compassion, courage, confidence, consciousness, and community. Next slide. So here are the 5 factors that are measured. And what we can say is that leadership in a compassionate school community is important. We need compassionate leaders. We need families who feel that they're welcomed into a school building and that their voices are welcomed. We know that conscious awareness of emotions and stress is critical, and is something that really we haven't focused on traditionally with many instruments or with even the education that many of our teachers and others get. So what is known about trauma and stress and its impact on the brain, the neuroscience? What is known about mindfulness as a support? And then we have a few other areas. Equity, is a critical area. We need to think about what our schools doing in regard to discrimination, poverty, and injustice. What are we doing to promote confidence and courage? Next. So most of you probably have heard of CASEL, the Collaborative for Academic and Social Emotional Learning. And CASEL, of course, has a wealth of resources, and it has its 5 areas: self-awareness, etc. We have an article that you can access here, and there's a crosswalk where we've looked at our 5 C's in relationship to CASEL. Note that there are many areas of overlap, but there are some other areas that we believe are critical and are also supported by research and evidence. And so we suggest you look at this and then consider whether or not Escade would be something that would be useful for your school. The work we're doing in New England is based on evidence-based practices in research. And we have a newsletter that goes out bi-monthly. This is an example of compassion action. In this particular article or newsletter, we had an article related to back to school with compassion, what we can do, how to build resilience. So these themes are addressed in ways with supporting research in this bi-monthly newsletter. This summer, we published a report on the work of the fellows and their views, their assessment of what's happening and the importance of what we're doing. Next. Some of the key learnings, I'll just mention a few. One, fellows did find out, they did report that COVID-19 and the trauma related to it was addressed, and that it was addressed in the context of looking at brain development and neuroplasticity. That mental health concerns, compassionate discipline, self-regulations, and the needs and concerns of parents were addressed. There are many resources provided to help schools, teachers, educators, and others. The majority of the fellows were satisfied and interested in continuing on and continuing with these topics. Trauma conscious leadership. No, I love that term. Not just trauma informed, trauma conscious, the conscious awareness of trauma and how that impacts your leadership. They're very, very high need and interest. The compassionate conversations that Dana mentioned, there's a high interest in that as well. Optimism and resiliency. You know, some of our best leaders are optimists. If you want to be a leader, you need to have a vision. You need to help provide hope for the future. So what can we do to help further that sense of hope and resiliency? And then they're interested in learning more about the compassionate school model and doing that through perhaps something like our book study. They also mentioned an interest in helping families navigate child therapy and having a centralized place. So let's say you're in a school and you need supports, you don't have them in your school, you can contact this place and you can get a mobile crisis team to come to your school and help you figure out what do you do next.
So Chris, thank you so much for that overview of the work of the Childhood Trauma Learning Collaborative and some of the underpinnings of how you're approaching that work. And I'm wondering, could you please talk a little bit about the CTLC fellows and how they interact and learn with the heart-centered learning model?
Certainly. When you think about what's going on in schools and where the needs are, we wanted to make sure that the fellows had a good understanding of the 5 C's, of compassion, of consciousness. So we provided webinars, and then we gave fellows many opportunities to dialogue and to really consider themselves, like what's going on, to look at their own schools, to use Escade, to say, you know, do we have the firm foundation we need? What else needs to happen to improve what's going on? So one of the things that we love about the CTLC model is that we took leaders in local communities across states and they networked together. And together they were able to problem solve as we shared the resources from the MHTTC and other resources with them.
So thinking about the fellows' work, you mentioned the Escade assessment and the factors that go into the Escade assessment and how it relates to the HCL model. Could you talk a little bit about the results from the Escade with the fellows and what factors were the most pressing needs?
Certainly. First, I'll just say that the whole area of school leadership and community involvement was highly rated, was the area that was rated most highly anyway, by almost all responders to our survey. And to me, that seems to say that we've put a lot of focus over the years in education on making sure we have compassionate leadership and we have good community involvement. Areas of greatest need, however, were first off knowing more about conscious awareness of emotions and stress, and how that stress impacts me internally. And what do I do about it? So knowing about neuroscience and trauma is something that, again, many teachers haven't had a background in that area, and they may not have tools to implement solutions to alleviate stress, tools like mindfulness. So that area was an area of high need. The other area of very high need, which, given everything we've seen over the last couple of years, is not really that surprising, is looking at the area of equity. When we think about equity concerns and discrimination, racism, injustice, there's a huge need across this country right now to make sure that our students have dialogues and discussions in their classrooms about these things and know about some tools that we can use to help overcome these. So those were the two areas of greatest concern.
And speaking of the tools and the practices that are used to help students overcome these kinds of challenges, could you give a couple of examples of the types of things fellows have done to implement these models and to address the Escade factors of most need?
Certainly. Let's go to Cumberland, Rhode Island, for example. In that school district, we had a case where Escade was administered. We had discussions about the results, and the Escade, is a very empowering tool. So we used a process where, in fact, teachers and others within the district formed teams. They looked at the results, and you can think about professional learning communities, or what we call core learning teams, where you could focus on a few grades, or you could focus on the elementary schools to begin with, and then later go to your high schools. But whatever you do, teachers look at the results, and then they have an opportunity to look at our action guides. Related to Escade, we have an action guide that really shows examples of what you could do to problem solve to make sure you have gains in certain areas. So we give tools and resources. So in Cumberland, they looked at the results, they chose action guides, suggestions to follow, and they might have done things like mindfulness training. That's one of the things that's been pretty popular throughout New England. And they might have done things like learning more about trauma and neuroscience. Those too are things that many of our schools and our fellows have attended to. They implemented this, and then a few months later, they re-administered Escade. So they were able to measure the progress and report that progress in their annual reports.
So now that we have an understanding of some of the work of the CTLC and some of the activities and perspectives that we have been working on developing within that work, I want to talk to you today about the HEART Collective, which stands for Healthcare Workers and Educators Addressing and Reducing Trauma. And the HEART Collective is something that Dana made a reference to during Chris's presentation. But what is HEART? HEART is a group of education, behavioral health, and lived experience leaders in the New England region who have been brought together to problem solve and think about school mental health services and how they could be enhanced through intentional collaboration between schools and community health providers. So why did we convene the HEART Collective? Why now? We know that in the time of the COVID-19 pandemic, we really have had refocused attention on the types of stresses and traumas that the children in our nation are facing. And we have a growing awareness of how those traumas and challenges are showing up in schools. And that extends beyond the students and children within schools, but also to the staff and the families and the communities that schools serve. So we know that there is an increased need for student mental health supports in school settings. We are also aware that not all schools have the funding or the staffing to provide those services to meet that growing need. And that many community healthcare centers or federally qualified health centers have the capacity, have the staff who are trained to help students and help children and families meet those challenges and build resilience. and they're already providing mental health care to youth and their families. And schools and community health centers have similar goals for supporting students, for supporting families and communities, but there are often barriers that make effective collaboration difficult. So we wanted to bring together this group to think through some of those challenges with this one central question in mind. What does successful collaboration between schools and community health providers look like? So we convened this group in September 2020, and it was convened by those of us at the New England MHTTC and in the regional offices in the New England region of SAMHSA and HRSA. One of the things that we did within that group is to revise and improve our compassionate school mental health model that Chris described earlier, to get feedback from people who are on the ground and doing this work. We identified barriers and best practices for school mental health collaborations by hearing from members of educational communities and leadership and community health providers, and also people with lived experience of having been students in schools. And we created an action plan to deliver training and resources to support the collaborations between community health and schools. So if you would, you can pause this presentation and just take a moment to think about the challenges and collaborations between community health and schools that you're seeing in your community. Think about where those collaborations are successful, but where they need additional attention, and to iron out some of the challenges that I'm going to talk about in a moment. And then think about how you would know if those collaborations were successful. What would that look like for the students and families that you work with? What would it look like for your school or community? And I just want to take a moment to remind you that this is work of the Heart Collective is rooted in this compassionate school mental health model. And you're seeing the revised model that our group worked to flesh out and make reflective of the challenges of schools and children's mental health providers. But we really, in all of our work in the Heart Collective, are focused on these 4 quadrants to take a whole child, whole family and community approach to think about reducing the causes of mental health challenges and trauma, to support youth where they're at, to develop protective factors, and to build resiliency. So this is the underpinning of all of our work together in the Heart Collective. Now, some of our educational leaders and teachers and school staff spent some time talking with us about some of the barriers to these collaborations from their perspective. The first is how to fund mental health services and supports. And the services and supports in schools and in communities vary widely across our region and across the country. And there's a real lack of knowledge or information about the role of community health providers and how schools might begin to build those collaborations and what kinds of resources community health providers might be able to lend to schools to support students. We also know that school staff are absolutely overwhelmed with academic pressures and the needs of their students. And there's a real lack of staff time to help coordinate these types of collaborations. And there may also be pushback on the roles of schools in mental health and whether that is the appropriate role for a school and educators from leadership or families. And there's always the difficulty of integrating these systems together in terms of policies or culture or demands and goals and histories of these systems. Now, from the community healthcare perspective, we also heard about their barriers, which are sometimes similar to those of schools, but include lack of support from leadership and community stakeholders, lack of staff time and expertise to coordinate collaborations because community health providers are busy trying to provide services, often with long wait times in an overburdened system. There's a lack of existing relationships that exist between these potential collaborating systems. We don't know how to begin often. And there's difficulty integrating the missions, the regulatory requirements, and the privacy requirements that community healthcare providers are bound to. But there's also the challenge in engaging students and families, whether that's in telehealth services, as we've seen during the COVID-19 pandemic, or in person. So how do you fully integrate these systems together and keep students and families engaged? And again, community health providers are facing an overwhelming need for their services, and that can sometimes lead to challenges delivering all of the needed services. We were also fortunate enough to hear about some critical considerations from young people with lived experience of mental health challenges as students. And they are cautioning us to remember that we need to increase our focus on social and family environments when providing care, that care doesn't begin and end with just students, but students exist within family, cultural, and community contexts. They reminded us that we need to help educators learn more about mental health support and increase their mental health literacy. We need to think about our assumptions about students who are, quote, good students or flying under the radar, who aren't necessarily expressing acute need, but might be really suffering. So the trauma and mental health challenges might not be readily apparent at all times. We need to think about how the mental health system itself might traumatize students and families, and how that kind of trauma might include incorrect diagnoses or the effects of labeling or medication, and hospitalization and interrupted life for students and families. We need to also think about the roles of schools in exerting academic and social pressures on our students and the expectations that can contribute to mental health challenges, poor mental health, stress, and trauma. I'd like to introduce you to May Reeves, who is part of our Heart Collective work, who's a 10th grader, to tell you about her perspective on school mental health and what's needed. And as May so eloquently describes, it's important for schools to think about these collaborations in order to meet all of the complex needs of students. So with the work and the advice from our Heart Collective, we have some next steps that we're working on for this year. We're forming a student advisory council with other students like May to help inform our work and make sure that it is really truly rooted in the needs of students and reflects their needs and preferences. We're going to be facilitating learning sessions and webinars about fostering these collaborations. We will be convening meetings with regional and state leaders about these collaborations and promoting a public mental health awareness campaign, which will include a Heart website that will be available shortly, that will act as a repository for all of these resources and information about our work. And as part of one of those resources that we are particularly focused on is creating a brief, free online course for anyone, available anyone on the Healthy Knowledge platform to help disseminate best practices for collaborations. And we're also constantly thinking about funding streams and how we can better fund these types of collaborations, which includes some of the newly released HRSA funding for school mental health.
So Martha, thank you. You, the Heart Collective just seems like a really good thing. I mean, if you think about what traditionally has happened, schools are, over here in an isolated silo, and then we have mental health providers out in the community usually. So I would like our audience just for a moment to imagine you're inside a school and that all of a sudden someone shows up at your doorstep. This is this mental health provider, and you really don't know why they're there or what they're doing, but you know that it's an important thing, and you have some students who have, certain needs. And then if you're on the other side of that doorstep, you might be the person coming into the school. You may have this medical background, you may have different terminology, and you know that when you maybe pull students out of a class for services, for counseling, for example, that the students are missing something. It seems to me that traditionally, this is not really worked that well. You know what I mean? because we've had schools in one place and mental health providers in another. And it's like ships passing in the night. So they haven't been that well connected. And I don't think we've used the strengths of the schools or the mental health providers to really fully support students. So Martha, what would your Heart Collective recommend that we do so that we can overcome some of these barriers?
Well, I think that scenario is a really common one around both schools and community health providers. And those systems were set up as being separate, but it's important to remember that we all have similar goals, which is supporting students academically and socially and emotionally. And those factors are really intertwined. So what's really important is to think about those collaborations, to build those relationships before crises occur. And we've got a lot of examples of that throughout the pandemic. But to not see each other as being separate or at odds, but to establish relationships and collaborations beforehand. So instead of thinking, oh, there's a social worker on the other side of my door, I don't know who they are, I can think, oh, that's Chris. I know her, and I know the types of things that she'll be talking to my students about. And from the perspective of the community health provider, knowing that, hey, this is a teacher that I can talk to, I can reach out to, we can strategize together. So it's really getting to know each other on a deeper level and establish the mechanisms and processes that support that collaboration so that we're prepared when students are facing crises or challenges.
Martha, that makes good sense. It really does. Sounds like it's all about communication, right? And relationships. So I'm thinking now of our audience again, and perhaps they would like to set up something like a Heart Collective in their own community. Do you think that might be possible?
I think that the Heart Collective was born out of the needs that were expressed by the people in our region, the need that so many health providers and schools have and the frustrations that they're exhibiting. And those are needs that are universal, and the challenges are universal. So of course, we welcome anyone reaching out to us about the Heart Collective, and we're happy to share the process that we used and how we found stakeholders and leaders to represent different perspectives in that system. But I think that a really important piece is to begin listening and asking questions and talking with people in your area. It's not rocket science. It's reaching out, building those relationships, and beginning that conversation together. And that can be done by anyone in any area. And so our aim is to provide resources to make that process easier, to demystify these large systems and to break it down to people who are united in supporting children, and to remember that children are at the center of our work. So please do reach out if you have questions or are looking for particular resources to get started. We'd be happy to talk to you more about our work.
Thank you, Martha.
Thank you. I'd now like to pass it to my colleagues Dana Asby and Stacy Champy to talk about using the Compassionate School Mental Health Model with multi-tiered systems of support.
Thank you so much, Martha. I want to start out by reading this quote from the book that Dr. Mason, Dr. Staley, and I wrote, Compassionate School Practices. Student mental health and well-being is best supported when solutions are implemented thoughtfully and flexibly, accommodating the individuality of students, seeing them as people first, and responding to them in the context of their individual needs and strengths, school climate, families and culture, and communities. I chose this quote because it really does explain the foundation of all of the work that we do in the Childhood Trauma Learning Collaborative and the Heart Collective, because we want to make sure that we're always looking at students as people first, but in the context of all of the different things that contribute to their well-being, their resilience, and their mental health challenges. I'd love for you to take a moment right now. Maybe you'll even pause the video and consider what you're doing around supporting student mental health. What kind of actions are you taking? What kind of systems have you built? Who are you involving in this work? And why are you doing this work? Go ahead and pause the video and consider what you're doing around student mental health. I'd love to talk to you about how our compassionate school mental health model intersects with the multi-tiered systems of support. First, just a very brief overview of what MTSS is. It is a tiered system of supports that has a foundation at tier 1, universal supports that go to every single student in the building. So this could look like a PBIS system. It could be forming positive relationships with students, which Dr. Mason spoke about early on in the presentation as being a really crucial way to buffer against the negative effects of trauma. This is also the social emotional learning and mental health literacy programming that we give to everyone in the school. Often schools and districts choose to do universal mental health screening as well. And we'll talk about some trauma-informed recommendations for that later in the presentation. At the next tier, tier 2, we select some students who have been identified as needing some extra support. And we provide that support in small groups or by using individual strategies like behavior contracting. We also work with the school and home together to get on the same page. Mentoring is another great tool to use at tier 2. As we monitor students' progress, moving them up or down the tiers as appropriate, we might get to tier 3, our targeted and intensive supports for just a few students who are really experiencing some mental health crises. So this might look like a very formal behavior intervention plan, or perhaps some specific therapy. Cognitive behavior therapy has been found to be very effective at addressing many of the problems that young people experience related to their mental health. Wraparound services are also a very important part of tier 3 services because we know that schools cannot often do all of the work that is necessary to support all students' mental health. Now, there are some crucial components of MTSS we all need to keep in mind. First, I'm showing you these pictures to remind you that there are 3 tiers. At the 3rd tier, we're doing individual counseling and sessions. At the 2nd tier, we're doing more group-based counseling and sessions. And then at the 1st tier, that foundation is whole school and whole classroom instruction. Now, at each of the tiers, it's important that our leadership is team-based. No one individual at any school can make sure that an MTSS system is effective. We all have to work together to create a system that works for not only all of our students, but all of our staff as well. At every level, we're choosing evidence-based interventions. We're using strategies that have been proven to work. We're also choosing social, emotional, and mental health curricula that are evidence-based as well. We do comprehensive screening and assessment so that all of our decisions can be data-driven. And when we're evaluating the effectiveness of our MTSS system, we can go back to that data that we get from screening and assessments. Now, how do we merge this with our compassionate school mental health model? Well, the MTSS framework is really designed to be delivered in the school building. Our compassionate school mental health model was designed for any adult who is working in a system, a school, a community, or a home where youth are. At the center of our model, we placed that young person and all of the various environments that they learn, grow, and play. And we believe that the 4 quadrants have to be implemented everywhere, all together, and they're more effective when we collaborate in concert and are reinforcing similar ideas in all of these different environments. So one really important part of prevention is evaluating all of these systems and advocating for systems change. When we support youth by identifying those that are in need and connecting them with community resources, we begin to increase their sense of agency to build resiliency. But it's also very important that we provide opportunities to lift the voices of families and students at every level of care and designing and planning. And then we also want to develop protective factors in all of these places. So building compassionate environments filled with nurturing adults everywhere that students are in after school programs, when they encounter the justice or correction systems, when they're in child welfare and foster care. All of these systems need some holistic wellness education to better understand how to deliver compassionate practices to youth where they are. Now, this framework, the Integrated Systems Framework from University of Connecticut, is a really great visual that shows how we can implement MTSS using compassionate school practices. Because here we see that there are things that we can do at school in each of the 3 tiers, but there are also things that we can do in the community with the community help. That might mean bringing in volunteers from community-based organizations. That might also be going out into various organizations, training the adults that work with youth in those organizations, and providing opportunities for collaboration. Now I'm going to pass it over to Stacy to talk more about how she implements the compassionate school mental health model within the MTSS framework at Manchester schools.
Thank you, Dana. So where did I start in order to build the compassionate school mental health model into my district's MTSS framework? Understanding and adopting key principle number 1 from compassionate school practices is at the foundation of this work. Schools have an opportunity and an obligation to help strengthen student mental health and well-being using evidence-based practices to alleviate trauma and build teacher and student self-care, resiliency, and coping. Support from administrators and buy-in from school staff, it's critical to build your school's framework to include compassionate school practices. In quoting from page 40, when schools purposely choose to build respectful relationships and meaningful connections with students, staff, and families, a sense of safety, belonging, and trust takes hold. So where did we start? An MTSS plan was drafted to coach schools in implementing Tier 1 and Tier 2-3. And then the plan was tested out in a demonstration site beginning with Tier 1. And this is providing me with feedback so I can determine what changes should be made before I begin working with the next school. And what key components did we identify for our Tier 1 blueprint in order to create a solid foundation that supports the compassionate school mental health model? First, database decision-making, positive behavior supports, which includes a positive approach to discipline, school-wide mental health prevention and promotion, aligned school and community practices, focus on family engagement, professional development specifically targeting compassionate school practices, and universal screening with a clearly defined referral process, which includes decision rules for student entrance into higher tiered supports. Now, looking at the targeted and more intensive supports, what key components did we identify for that blueprint, for our Tier 2-3 MTSS blueprint? Database decision-making, coordinated school and community-based supports. Now, this was talked about several times in the presentation, and an example of some of the collaboration that we've done with our Community Mental Health Center for targeted supports at this tier for our students is if they're working on skills in their counseling at the Community Mental Health Center, there is a family skills therapist that can come into the school and support those skills that they're working on in their outside counseling in the school environment. So that is something that we are doing in our demonstration site around the collaboration with our community mental health partners. Next, we have targeted professional development and clear entrance and exit process for interventions. And the interventions need to be evidence-based and matched to student need. If you refer to your supplementary materials, you'll find this blank MTSS template. Think about how you are already or may be able to include compassionate school mental health practices in each tier in your school, and use this template to discuss areas of strength or areas of need in each tier with your school teams and administrators. And if you're considering writing an MTSS plan for your district, you can use this template to make notes as we go through the next few slides. As mentioned earlier, a demonstration site was chosen, and this site is informing our coaching materials. The school was chosen as the demonstration site because of its identification as a school in need of improvement, the percentage of out-of-school suspensions, the diverse population that it serves, and a high turnover rate with administration. Aligning initiatives and community resources takes time, coaching, and collaboration. And in our demonstration site, currently most of our work has been at Tier 1, but we're beginning to collaborate and coordinate Tier 2, 3 resources and interventions. This is the MTSS model that has been developed for the site with a selection of evidence-based practices across tiers. Tier 1 includes school-wide supports such as positive behavior supports, and Tier 2 includes targeted interventions such as a small group counseling, check and check out. In Tier 3, the student will have an individualized team with community agency involvement. Here's how we're addressing each quadrant of the compassionate school mental health model. In the first quadrant in the model is prevention. And in our demonstration site, a daily mindfulness minute will be implemented after morning announcements, and this will eventually be student-led. There's also a focus on staff wellness with professional development on secondary traumatic stress and access to resources and support if needed. And all of the systems and practices will be evaluated for fidelity of implementation and to assess outcomes. It helps us to know that what we are choosing to implement for practices is working, and it also informs us what we may need to change. In our site, we have an evaluation plan showing when we will review data and what tool we will use to measure it. The Escade is one tool that is being used to measure baseline data prior to implementing Tier 1. After the first year of implementation, we will collect this data again to determine if the components we intended to address around compassionate school practices are actually being addressed. This will also help us improve our coaching materials as we move on to the next school. In the next quadrant, supporting youth, we want to ensure that all students always have access to Tier 1 and that has been implemented with fidelity. And I understand the challenges that teachers face in the classroom with the variety of learning needs and behaviors. And often difficult behaviors can be addressed at Tier 1, but the teacher may not have the training or the staff to support the student. And we cannot effectively support students without supporting the teachers. So we've created a Tier 1 decision-making tool that's utilized before students are connected with higher tiered supports. And we've built resources into this tool to guide the teacher with addressing low-level behaviors and help them to problem solve first. And this isn't to put more on the teacher, but to put the focus on their relationship with the student, keeping the student in the classroom and supporting them with best practices. We also want to make sure that we connect youth to the appropriate services if they do in fact need higher tiered supports, whether they're school or community-based. And when I'm working with a school, I use a community mapping tool to determine who the community partners are that are working in the school. Some of you may have tools to assess community-based supports in your school or district. And for those of you that do not have something like this, the MHTTC network has resources to support you. Dana, could you tell us where we could locate these?
Absolutely, Stacy. So the National Mental Health Technology Transfer Center Network partnered with the National Center for School Mental Health to create the National Best Practices Implementation Guidelines, which is a very long title for a great product that has various modules that help any school, district, or state understand how to build or refine your comprehensive school mental health system. And module 3, the needs assessment and resource mapping module, has a lot of great information and tools to find some of those mapping strategies. I will point out where you can find that later on in the presentation.
Great, thank you, Dana. In the third section of the model, it talks about protective factors. And this includes targeted professional development in our demonstration site. We want to support and grow nurturing staff with the knowledge and skills to successfully implement the selected practices in the MTSS framework. Targeted professional development includes areas of positive behavior support, relationships, and mental health literacy, all staff in our demonstration site participated in the MHTTC Classroom-Wise training. Another example that we are building into the site to develop protective factors and cultivate a sense of community is collaboration with the City Health Department, Neighborhood and Family Health Division. There's an individual from this department who sits on our Tier 1 school-wide team. And the last section addresses resiliency. At Tier 1, we are teaching the social emotional curriculum school-wide. To support this, there's a dedicated space in every classroom for self-regulation, and use of this space is explicitly taught with self-regulation strategies from the SEL curriculum. This space was inspired by the National School Mental Health Curriculum under Mental Health Literacy, enhancing help-seeking efficacy, know where to go, when to go, what to expect when you get there, providing our students with necessary skills and tools for self-regulation. This practice will be reinforced through collaboration with our Community Mental Health Center, providing training for staff on recognizing signs of distress such as trauma, anxiety, and depression, and for students recognizing their feelings and emotions. In the center of the Compassionate School Mental Health Model, we focus on youth, home, community, schools, and systems. Here's the model that we are using to ensure we have all voices at the table on our school-based teams. In our demonstration site, the Tier 1 team includes family representation and before and after school program coordinators. The Tier 2-3 team includes community agencies that provide targeted or intensive support in the school. And systems work includes targeted training and collaboration with community agencies to implement or align interventions.
Thank you so much, Stacy, for explaining what Manchester School District does to bring the Compassionate School Mental Health Model into the MTSS system. Now, we mentioned earlier on that universal screening is often a really important part of that universal tier of MTSS to try to identify some of those students that might need Tier 2 and 3 supports. However, we have some trauma-informed recommendations. We first need to understand why we screen universally. It opens access to services, and some schools and districts, depending on their policies, require a formal diagnosis so that screener can lead to that process that will allow families to get these services for free in the school building. It can also help identify those students who are internalizing anxiety or depression, who might appear to be those good students that teachers don't think to check on, who Martha mentioned earlier. Universal screening can provide an opportunity to start conversations about mental health. Perhaps that's between staff members, between teachers and students, or even with families. This screening provides that really important data that not only helps us put students into the various tiers, but assesses how successful our interventions are. If used properly, universal screening can actually increase the acceptance of mental illness in the community because it becomes something that people do not think of as rare or weird or strange, but something that all of us experience at one point or another during our lifetimes. However, there are sometimes some unintended consequences of screening if we're not doing it intentionally. We know that research has shown that bias can occur when educators are given a diagnosis for a student before they even meet that student. So think thoughtfully about how you're conveying and communicating the results of these screeners. How are mental health diagnoses reported in students' records? And think about the FERPA and HIPAA privacy laws and who you are sharing this information with and why. Another thing we need to understand about many screeners and assessments is that traditionally they were normed on middle-class white populations, and that might not match your personal student population. These days, Many psychologists and researchers are being much more intentional about norming their assessments on a diverse student population. And if we don't choose those screeners and assessments, that might result in an under or over diagnosis of certain mental illnesses, depending on the students. So do some research to choose the proper screeners. We know that when we communicate with students about the specific labels that they get from their diagnosis, it can really affect their self-esteem. So when we do talk about a young person's mental health with them, we need to use developmentally appropriate language and decide how much information is really important to share with them. One thing that schools and districts really need to think about is what staff is going to be doing with their time. If you have a limited amount of school mental health staff, is all of their time spent doing these screeners and assessments and analyzing the results? If we are not mindful and thoughtful about the way that we do screening, it actually can increase mental health stigma. So we want to use some of the trauma-informed recommendations that we have so that we can avoid that. First, and probably most importantly, we really need to understand whether our level of mental health staffing better supports universal screening or universal social emotional skill development. If you only have 1 or 2 mental health providers in your entire district, it might make more sense to do universal programming rather than screening, but that's a decision each school and district needs to make for themselves. Whoever is delivering the screeners should have proper training. And when we have school mental health professionals who have been in their positions for many years, it's important for us to ensure that they're getting regular professional development to stay afloat of the new ideas in the field. Whenever we do screening, we need to make sure that we're doing mental health literacy as well. Stacy mentioned early the classroom wise modules. We'll speak more about that in a little bit. That's a great tool to provide free mental health literacy training to all teachers. But we also need to do this for students and for their families, teaching them about how to identify the symptoms of a mental illness and how to compassionately respond if they suspect that someone they love is struggling with a mental illness. We also have to ensure that there are follow-up services when we identify students who are experiencing a mental health challenge or crisis. What plan do we have in place to help alleviate those challenges? It's very unkind to screen and have no plan to do anything about the problems that have been illuminated. Finally, I urge you, if you are doing universal screening, to take some time and do some research and find culturally competent screeners that have been normed on diverse student populations. Now, I'd love for you to take a moment to reflect on the screening process in your district. How do you screen? Are you screening universally? Are you screening just a few number of students who teachers identify as potentially needing some extra support? Are you doing this on electronic screeners, or do you have paper and pen screeners? Who is analyzing the results of those screeners? What happens after the screenings? What interventions have you identified that might help students who show that they could possibly have anxiety, depression, or another mental illness? And as you design this entire screening process, whose voices have you brought to the table? Have you asked about student opinion on the way that you do screening? Have you asked classroom teachers how well it's going and what ideas they have to improve the process? Have you brought family members in to get their opinions? I ask you to pause this presentation and take a few moments to reflect on how you screen in your school or district. Now I'd like to talk about the importance of educator coaching. I myself was an educator coach for a project where we were looking at the fidelity of implementation of a growth mindset curricula. And we found that those teachers who received coaching, they did a much better job of implementing the curriculum with fidelity, and they felt a higher level of self-efficacy for themselves as well. Now, my personal experience was reflected in this meta-analysis of 60 studies on educator coaching. And they found that coaching improves the quality of an educator's practice as much as a full decade of experience. So we know that coaching really works, and it's a very valuable tool. Now, one of the projects that was part of the meta-analysis was the digital learning project. And some specific lessons from that project were pulled out. They found that for the highest level of effectiveness, it's very important that the coach and the educator have adequate time to engage in coaching activities. So that means that we're not just putting the coach in the classroom where the educator is delivering interventions or instruction. We're also allowing them time to debrief afterwards, and also to practice new skills, do research on what interventions might be more successful, and engage in follow-up coaching sessions as well. It's also important for coaches themselves to continuously engage in professional development so that they make sure that they understand the latest research in the field. We know that coaching is much more effective when there is dedicated funding for these positions. And if there is a concerted commitment to making coaching sustainable, this funding will not just be for 1 or 2 years, but will become a permanent position for an educator coach. I'd love to pass it back to Stacy to talk more about her Train the Trainer coaching model in Manchester School District.
Thank you, Dana. Our district is investing in multi-tiered system of supports, first by adding my position as a district coach to set up the systems, and now by hiring additional coaches. And we're creating an overall plan to train these coaches so there is consistency across the district with implementation. Using the coaching guides, district level coaches are trained to work with school teams on establishing tier 1 and tier 2 systems and practices in the schools. And when the MTSS coaches are working with the school teams, they help them to create a framework that fits that school's culture and context. And some of the work that these coaches will be doing in the future as the need arises in our demonstration site is going into the classroom to do some specific coaching there as well, because it is a need. And we're finding that as we're working in this pilot site. This model is further supported by a district and community leadership team. Martha talked about barriers earlier, and this team will help to address these barriers between community and school-based services. Directors of the community agencies that are represented in the schools sit on this team, and this team reviews district-wide data and community data, such as attendance, nurse visits, discipline, and homelessness, to target areas of need for community support or school training and professional development. As the coaches work with the school-based teams, any issues that are identified with systems and practices are looped back through district to this team to address. And this team will be focusing also on the work that is being done in the demonstration site to help support and improve the systems prior to replicating the model at the next site.
Thank you so much for sharing all of the great work that you're doing in Manchester School District. And Stacy and myself, we both mentioned some really great mental health technology transfer center resources that are available for free to support school mental health. So I'd love to introduce you to some of these. And when you do get your slideshow that you can download alongside this presentation, these are linked to each of the images that you see here. So Stacy earlier mentioned the resource mapping. That's one module in this National School Mental Health Best Practices Implementation Guidance. Alongside that, we also have an Always and Now 8-part learning series that helps you understand how districts and schools across the nation are implementing some of these best practices. At the Childhood Trauma Learning Collaborative, we've been creating resources for the past 3 years based on topics that fellows identified as very important to support school mental health systems. So we have this topical resource directory that breaks down all of the blogs, webinars, toolkits, and briefs that we have created over the past 3 years into topics. One of those tools is called Schools This Year. This is a suite of resources, the primary one being our toolkit Back to School After COVID-19, supporting student, family, and staff mental health. That's a toolkit that gives you comprehensive instructions on how to support mental health for everyone in your school community, so you can address the trauma and grief that COVID-19 brought and rebuild that compassionate school community. Alongside our toolkit, we also offer you a slideshow that breaks down the key components that we suggest from that toolkit. And you can use that to train your school staff or to introduce some of these practices to family members and community-based organizations in your city. The final product there are some tip sheets that pull out some brief strategies that any educator or family member can use. You could print these out and post them in your staff room or give them to families in a take-home folder. Down below that is our free training resource library. So this compiles every single webinar that we have done from years 1 through 3, and they are available for free for you to use for professional development opportunities with your staff. In the bottom right corner below that is a link to our Classroom Wise suite of resources. That goes to the Classroom Wise library of resources, videos, as well as a link to enroll to the 6-module Classroom Wise mental health literacy course. This is appropriate for any adult working in the school building or working with youth around mental health supports. Finally, at the Childhood Trauma Learning Collaborative, we developed a 12-hour course that provides you with 12 hours of CEUs called Cultivating Compassionate School Communities that Respond to Trauma Effectively. Now, this course really takes you through every single step from start to finish for how to develop a comprehensive, compassionate school mental health system. So we urge you to check out these free resources to support your refining, designing, or we urge you to check out all of these resources to design or refine your comprehensive school mental health supports.
So Dana, Stacy, Martha, wow, thank you. What a comprehensive package. You know, I'm thinking of our listeners, our viewers, and everything they've heard in the last 70 minutes, 80 minutes. And if they're at the beginning, you know, this might seem like a lot. So I just want to pause for a minute and reflect on some of the key points. And one of them might be is, you know, it's good to have a coordinator, to have a point person in your district so that you have someone like a Stacy to help you keep things organized. I think that would be a huge help. And then the other reflection is that we know that trauma is pervasive. Before COVID, we could say that in many areas, there's 1 out of 20 kids who were impacted by trauma before the age of 6, early on. And we know that after COVID, you know, all of us have been impacted. If you're living in poverty, if you're living in an area of violence, if you've gone through a home situation where in fact there is a divorce or there's abuse going on, all those things impact the adverse childhood experiences that you experience. So what can we do so we can keep this really simple and get back to the heart of compassion? And so, you know, if you don't have the resources to do it all, where could you start? Dana, do you have an idea?
Yes, that's a great question, Chris, because as you mentioned, schools are feeling so overwhelmed with all of the needs right now. And one thing that I often recommend schools do to start this process is to really focus on creating a sense of community and belonging. As humans, we really want to feel like we matter and that we're a part of a group. And one way to do that is to increase the sense of safety that our group members feel through routines. And schools have many opportunities to do that. If we're at the elementary or early childhood level, we might consider doing morning meetings. If we're at the middle or high school level, this might look like advisory periods where we have that one consistent adult who is there to offer advice and answer questions. We can also do mindfulness routines that might be coming back from lunch and having a minute to do some yoga or a meditation, or as Stacy mentioned, starting the day out over the intercom each day with a mindful minute. So having these routines in place not only helps staff and students feel that sense of safety that was taken away during COVID-19, but it also brings us together as a community.
Dana, community is important. That's one of the 5 C's, and we really believe that establishing a heart-centered community and helping to grow that community and nurture it is critical. Martha, what would you add to that?
I think Dana just gave some really wonderful suggestions, and I know there is a lot that's contained within this presentation for things that people can do. And I think that what I want to say to that is that it's important to also understand that trauma does not just affect our students, but also affects us as educators and school staff. And that while you are being educated in providing trauma responsive, community oriented, compassionate environments for students, that it's also really important to extend that compassion and connection to yourself as an educator or a mental health provider, and to your colleagues as well, and to tend to your own sense of overwhelm and trauma, and to see that as not only helping you, but also benefiting your community. So taking care of yourself has ripple effects that are really positive, and is also, in addition to the benefits of caring for yourself, is really a great example and model for your students and your colleagues.
Martha, you make a great point. So often we are so busy. We've got lessons to prepare. And last year we were doing all this remote learning, which, that was a lesson in itself. And so it was really hard to find the time sometimes to take that deep breath, to go for a walk, to make sure we had the right nutrition. And, sometimes our self-care suffered. When our self-care suffers, our students suffer. So I really applaud what you're saying, and really would reinforce that concept for our listeners. Stacy, what about you?
I think that I would focus on relationships, positive relationships with your students. In the elementary schools where I'm working, we're looking at bringing in targeted training for this, intentional and inclusive relationships, because if we don't have that basic foundational piece, it's going to be hard to work with our students. And all of these wonderful systems that we're setting up and practices are going to fall flat if we can't focus on that piece. I did work in a collaborative with someone who's at the secondary level, and I have not yet started coaching there, but I would love to bring this idea in. A middle school did an activity called relationship mapping, where they posted all the students' names somewhere in the staff lounge, and every staff member that had a positive connection or a connection of some sort wrote their name next to a student's name. And if there were students that didn't seem to have a connection, they purposely made those connections. So every student had a positive relationship or some kind of connection in that school. So there's work we can do around that at all levels, and I feel like that is somewhere that we can start.
Stacy, you know what? You are absolutely correct. I mean, protective relationships, protective factors are so important. And it could be that one adult, and you could be the adult in a child's life. And it may be just a kind word here and there. That it's amazing how simple it can be. So what I would add to this is just the thought that when we get busy, it's so easy to ignore all of this and just to focus on what we're trying to achieve, the academic goals, etc. So I think this conscious awareness of how we're feeling when we get stressed out, so we're aware that, you know what, hey, what's going on with me? And then think about your students and think about what's going on with them. And what can you do? What can you do to ease their stress? You know, it might be giving a student a pass. So a student's behind academically, is stressed out, you know, something's going on, you're not sure what it is. And you might just say, hey, you know what? I just want to give you a little time this weekend to do something other than to delve into this textbook. So conscious awareness, relationships, community, and self-care. These are some of the things that we believe are absolutely critical. And it's a really good place to start. It really is. Start with, you know, making sure your staff understands these things and is doing what each of them can in their own way to really promote this positivity within your school. Thank you so much. Appreciate everything that everyone said today.
Thank you so much, Chris. And we thank everyone for being here today. A reminder that most of us are staff members of the New England Mental Health Technology Transfer Center Network, and we are funded by SAMHSA, which does require us to evaluate any of our presentations and services. So if you would take just one single minute to answer 3 very brief questions, there's a link that you'll get in the slideshow, or you can right now pull out your phone and scan that QR code to get to the link. We also invite you to sign up for our Compassionate Action newsletter. There is a link there that you can visit to sign up, and follow the New England MHTTC on Twitter, Facebook, and LinkedIn. We also invite you to reach out directly to us if you have any questions whatsoever. All 4 of our emails are listed here on the last slide. We urge you also to visit the New England Mental Health Technology Transfer Center's network's website so that you can find any of our upcoming events and get some of our resources, all of which are freely available to the public. If you have any questions about the work of New England MHTTC, please feel free to email us at newengland@mhttcnetwork.org. Thank you so much and have a wonderful day.